My name is Sarah Eber. I'm a registered dietitian, licensed in the state of Missouri, and certified as a diabetes educator. I'm also a quality improvement and coordinator and educator at the Northeast Missouri Rural Health Network.
Okay. What's your degree and how much education is required for your position?
Oh, those are three different questions. Okay, my degree is a Bachelor of Science in Foods and Nutrition from Purdue University. To be a registered dietitian, there's typically additional on-the-job training kind of thing, and there's several different programs. And the key to that is to find one that's certified by the American Dietetic Association. There's several master's programs. There are some coordinated programs where you actually do that as part of your undergraduate degree, although that's a little marginal. And then there's internships programs. So after you complete your bachelor's degree, then there's an additional internship to finish some things off. So that gets you to the point that you can sit for the registration exam. Licensure is just by state or certified by state. So typically you can do that within a year of graduating with your bachelor's degree. Or if you go on with your master's, then you should come out with a master's degree as well as your what they call is RD eligible, which means you can sit for the registration exam. Okay.
So each license is different by state?
Yeah.
So what's required in Missouri?
Typically, they all require about the same thing, that you be a registered dietitian, although there are some states that have some designations that don't actually always insist that you be a registered dietitian. The registered dietitian has the biochemistry and the chemistry and the science and the anatomy background. Similar to what nurses do, but a lot more chemistry, a lot more biochemistry, and some food science. So that's what it takes to get you to be a dietitian. Dietitians can work in a lot of different industries. Typically, you think of dietitians working in a clinical setting, which are typically hospitals, or nowadays, hopefully more physician practice offices or outpatient endocrinology clinics and things like that. There's a lot of dietitians that have their own businesses, that work sports medicine. There's a huge variety of field that you can do as a dietitian. There are a lot more and more increasing dietitians in the public health field. Public health is a little different. It's an evolving animal, much like dietetics was 20 years ago. Now, in order to do what I'm doing, as far as the actual requirements, you would just require to be a registered dietitian. My position, I've also done diabetes self-management training, so being a certified diabetes educator is very helpful, but as a dietitian, you're trained to work with diabetics, whether you're certified in diabetes education or not. So you don't necessarily have to be certified. But now for a registered nurse to do any nutrition education with diabetics in terms of self-management, it's really better if they also have the additional certification, because a lot of other career fields don't have anywhere near the nutrition concentration to work through some of those things. And dietitians are also usually trained in behavioral management, so as you're dealing with population health, which is public health, that comes in pretty handy. Now, as far as my position, the requirements, there's a lot of different degree fields that could do this, but I'm not going to tell you how many years I've been a registered dietitian, because that would totally date me. But let's just put it that you were not even in high school yet when I started being a registered dietitian. Okay, so I've done this a lot of years, and I've worked in community settings, I've worked in clinical settings, I've worked in outpatient clinical settings, inpatient clinical settings, and of course a lot of public health. And I've also been an administrative dietitian, so I have had personnel and dealt with disciplinary action and worked with budgets and quality improvement indicators. So I've done a lot of these things, and public health really meshes medicine and business, and that's really the way the field is evolving now. So to try to answer your other question, to do this position well, you probably need a master's in public health, and hopefully I will, if I survive epidemiology this semester, I will have it.
What are personal characteristics that you feel are necessary for a dietitian?
For a dietitian, okay. For a dietitian, you have to be a little otherly. Okay, you've got to be patient, and you need to be very open to other people, and really be now. And I guess I should back up and say it depends on what area of dietetics you want to be in. If you want to work in public health, then all those things are very necessary. Okay, if you're administrative, then you absolutely need systems management and be very matter of fact and be ready to work in a different world than you're nurtured and brought up in as a dietitian. And if you're working in sports medicine, then you need to be very comfortable as an athlete or as someone who's been around that a long time. So I guess it would just depend on where you want to go. A dietitian working in public health needs a clinical background, because at any given time you could be working with
How would you describe your job?
It changes about every 20 minutes, so that's impossible for me to say. Now, my job with the Rural Health Network actually is a grant-funded project, and so it's only technically 20 hours a week. So the answer to that depends on what day you catch me. Today, I'm working with my Access grant, and our purpose is to bring chronic disease self-management into a primary care setting, which doesn't sound a lot like public health, except that part of this kind of new way of thinking also is working to helping physicians' offices blend better and know more about the resources available in the community so they can get their patients help. And that was one of the things as a dietitian that I was really struck by, because I could do behavior management one-on-one. I can get people to change their eating behavior. I can get them to spit back to me what they need to do if they understand it. And as soon as they walk out the door and they're surrounded by a toxic environment, I mean, it's a very difficult thing to do. And so ultimately, you've got to have the community support. You've got to have the doctor saying the same thing to you that the dietitian is saying to you, and to help you to do all those things. And it doesn't matter whether you're changing your eating habits or whether you're trying to stop smoking or any other habit that you want to change. You've got to have that kind of support. So I guess at this point, this particular grant kind of bridges that gap. So this has me in any given time looking through figures and looking for quality improvement indicators, working through quality improvement studies. There is some patient education, like we actually will teach classes and do some self-management training, so I'll do some nutrition therapy there because that's my role. I work also as a coach with this grant, so I'm working with other health professionals to teach them, because this is a new skill set for most health professionals. 2 days a week, that's what I'm doing. A couple other days a week, I work with a program called Missouri First Steps. And there's not very many dietitians that work with Missouri First Steps, but it's a little unique. It's funded through DESE, and ultimately you're working with babies ages 0 to 3 who have some kind of delay or developmental problem. So you're going into their homes, which you're weighing and measuring, because dietitians are consistent that way. We're kind of systems focused, and I've followed a lot of nurses, and I'll use that term loosely because they're not always registered nurses, they're not even licensed sometimes, but they can't get an accurate weight. So I walk in with my little scale, and I can get accurate weight and accurate head circumference and an accurate length, and that way we can really measure that baby's growth accurately. And then I work with the mother right there in her own house to make sure she's giving good nutrition, because a lot of moms think chicken nuggets are good nutrition, and then we flip the food label, and they're all very different. You should go do this. Go look at the grocery store and flip the chicken nuggets. Very different protein grams between and serving sizes between the different packages. So we flip whatever they've got in their house, and I teach them. And some of them are amazed at how little protein their baby's actually taking in. Boom, there's why they're not growing. It's not that mom's not trying to feed them, mom doesn't know how to feed this baby. Okay, so that's Missouri First Steps. And I've got 28 patient babies on contract. And so I'm running all over central Missouri with that. Then I also consult at Lock Haven Nursing Home. So let's flip and go to the other side of the spectrum and take care of older Americans that you have a lot of very big variety of chronic disease and end-of-life issues. So pick the day, and I'll tell you what today it's Access.
Where have you worked previously?
I haven't worked at WIC, although I've worked with WIC. I haven't worked in sports medicine. I haven't worked with corporate accounts like Kraft, although I had a couple job offers.
So are these places where dietitians typically work?
Can work that I haven't been.
Okay.
I've done outpatient clinical nutrition, inpatient clinical nutrition, critical care. Didn't like that scary. Renal nutrition, diabetes is my thing. That's my specialty. That and geriatrics. I've done those most of my life. Public health, community education, community outreach, and I've run food service kitchens. I've done a lot of stuff.
Do you have any tips for high school students considering pursuing a career as a dietitian?
Well, get your science and your math. And most science and math teachers, if you show them that you're trying, will stay after school or come in early and help you. So learn it. And I was just working with my 15-year-old. She's in physical science. Well, she's like, I'd rather do biology. This is so boring. I said, Vika, this is the fundamentals of biology. You've got to learn it. I don't care if it's boring. So I read it, and then I do something different with it, because that's what I do. I help people manage their behaviors. I help them manipulate their behaviors to do it well. I'm manipulating her behavior so she can find something interesting in physical science. But ultimately, get your science down now and learn how to cook, because you learn intuitively a lot of things about food and behavior from learning how to cook. So it's not all just about the food. And even if you don't like to cook, you at least need to know how. And because food is a fundamental basis of social interaction, it's a fundamental basis of a lot of things. So, I mean, you may have really bad arthritis, but your pain medicine is not going to work if you're not don't have an adequate amount of protein. A lot of medications that you might need aren't going to work if you don't have an adequate amount of protein. You don't grow healthy babies inside you if you're not eating right. So everything, it's all about the food. So learn about it and have fun with it. Work in a couple of different places so that you get to do different things. Or if you can't get a job, volunteer. Volunteer at your food kitchen, your local soup kitchen. Go help an adult make deliveries to some of the people who really don't have any money. It's an eye-opening experience, and it will. If you're even remotely interested, your passion grows that way.
Okay. How does your field relate to public health?
I was doing clinical dietetics and administrative dietetics for years, and I thought that's what I did. And then at some point I started working on this master's in public health, and I realized I had been doing public health all along. Public health is population health. Okay, so I work a lot with the individual, but a lot of the things that I teach my individuals to do, I teach them to work in their communities so they can support themselves. And also, as I've always done my clinical work, I've always worked with the State Department of Health, because the State Department of Health has their fingers in a lot of health programs. And so whenever you work with the Department of Health, that is what's going on in public health in the state of Missouri. So I've been really lucky. I've gotten to work with the Missouri Diabetes Prevention and Control Program, and I got to work with MOCAN, and I don't know how familiar you are with MOCAN, but that's the Missouri Council on Activity and Nutrition, and I can remember we were in focus groups and doing strategic planning way back when it was before it was ever MOCAN. And then I'm also active on the Missouri Dietetic Association board, and so all of that has to do with population health. A lot of the activities we do are population health. The flip side of that is I have done, believe it or not, a little policy work. I'm not terribly interested in it, but I've done it, and one of the policies that's being formulated now, actually by our representative, will go to the floor, hopefully will come through, and it will have a huge impact on access to care for rural poor Missourians. That's public health. So how does a dietitian work in public health? You just get out there and teach. But I'll tell you, the one thing I think that every dietitian should, if you think you want to be a dietitian and you like learning this stuff, you can't be a good dietitian unless you have some sort of spirit of volunteerism. You do your classwork, you do your other things, but then you get out there with people and you help out, and then it just fires you. Now you're doing public